The most common reason for hip replacement is hip arthritis, and that can present a number of different ways. Everything from groin pain to even knee pain sometimes. The pain will radiate down the inner side of your thigh. Patients will have limited range of motion. They may or may not develop a limp. As the pain progresses and starts to interfere with their quality of life, we can get to the point where they may need a hip replacement. You can also get a hip replacement for what's called aseptic necrosis, where the blood supply to the hip dies, or following trauma. You could have a fall leading to a broken hip, and that could also necessitate a hip replacement. Well, the hip's a ball in a socket, and what happens is the cartilage, which is the cushioning between the ball and the socket, wears. As we do the surgery, and there are different ways you can get into the hip, but once you're in the hip, the surgery is the same. You remove the ball, which allows you access to the socket. You clean out what's left of the cartilage in the socket, and you put a new socket in. Then you put what we call a stem, which is a short rod that goes inside your femur, and the stem has a little nub at the end of it that you then put a new ball on, and then you would put the hip back in place and you close it up. Well, traditionally, hip replacements were done either from the back, what we call a posterior approach, or from the side, which is a lateral approach. It doesn't matter how you get in the hip, but once you're in the hip, the operation is the same. Over the last 8 years, I've been really enjoying doing the hip from the front, which we call an anterior approach. The big benefit of the anterior approach is it's what we call muscle sparing. You don't detach any of the muscles. And because of that, the recovery is a little bit faster. The hip tends to be a lot more stable, the chance of it popping out of place are less, and patients get back on their feet faster. The big downside of the anterior approach is it's hard. You're working with a very small window, and it's very technically challenging. And so it's been one of my favorite pursuits over the last 8 years, is getting better at it and perfecting it. Hips are amazing in that people tend to recover from hip replacements very quickly, which is the complete opposite from knee replacements. The average hip replacement patient goes home the next day. Some are even going home the same day now. You're on a walker for a couple of weeks, but usually by 2 weeks or 3 weeks from the surgery, you're off of a walker onto a cane. And then the cane is for comfort, and by 6 weeks, most patients have put down the cane. Most patients by that second week feel better than they did before surgery. The arthritic pain has been replaced by the post-operative pain. And the good news is as each day goes by, the post-operative pain does get better.